you can go up quite marginally, quite fast to get.
16 health professionals from Westlock are at the STARS base in Edmonton. They're here for a day of training on how to treat patients who are in shock.
We call it the ABC 1, 2, 3 approach of shock. And the intent of this is to give them some ideas and tips and tricks to handle in the first 5 to 15 minutes to make sure that we can manage the airway, breathing, and circulation of this patient.
The biggest thing with shock was we see it frequently. The way of treating shock is constantly kind of changing in the first line stuff, and we've all learned a lot of stuff already this morning.
Health providers rotate through 4 skill stations in the morning.
That you're just gonna hold.
I really like the airway. I don't do it a lot, so just having that refresher.
If it's a tibial IO, if you squeeze the calf and the flow stops, it's no good anymore, it doesn't work.
Boy, I've learned so many things, not to be afraid of doing an IO.
It's not like a long-term thing. Okay.
The day was funded by rhpap's FIRST program. To qualify, the training session must be multidisciplinary. The group from Westlock included a physician, RNs, an LPN, a paramedic, and med students.
I just want to thank rhpap for the grant. I think if it wasn't for this type of money and commitment to rural, we wouldn't have this opportunity, and I'm grateful for the newsletter because I never would have found out about it otherwise.
Rachel is referring to our monthly newsletter called rhpap Review. To sign up, go to rhpap.ca/subscribe.
Her friend went to go check on her today and found her very drowsy, very hard to rouse.
Okay, so section her, section.
In the afternoon, the Westlock group at STARS rotated between 2 simulations.
The simulation is all about what we call crew resource management, which is basically how do they communicate as a team, how do they work as a team, how do they make sure that everybody's on the same page.
Rachel has seen firsthand the difference simulation training can make in rural hospitals.
Last month we did pediatric sims at our hospital, and 2 days later we had a very severe pediatric case come in, and our nurses that had been on the education were working that day, and it was absolutely invaluable.
I think just adds more confidence to us, especially in rural sites. You kind of can recognize it quicker.
Someone will monitor the oxygen.
I'll monitor that.
Do you have a training idea in mind for your rural healthcare team? Check out rhpap's FIRST program. Go to rhpap.ca/first.
I just highly suggest anybody that can do this, do it, because it's worth it.